Hi everyone, welcome to our Chinese medicine study channel. Today we're going to continue to talk about modified Xiao Yao San. In previous video, we have discussed the ingredients of Xiao Yao San and the functions of Xiao Yao San and why and how does Xiao Yao San work. So in this video, we're going to continue to talk about how to modify Xiao Yao San in our daily practice. The last topic we talked last time is Cai Hu. So Cai Hu have the side effect, or some practitioners, some schools of Chinese medicine, they believe that Cai Hu have the side effect of consuming yin. So if got yin deficiency, especially for liver yin deficiency, when you use Cai Hu, you need to be careful the dose of Cai Hu. So sometimes in Xiao Yao San, we use very small dose of Cai Hu, and also Cai Hu is the liver herbs, the herbs used for liver problem, and so if we see patient with emotion problem, we thought that it was because of the liver stagnation. You can't use Cai Hu directly. You need to see if there's any indeficiency there. If there's no indeficiency, then you can use. If there's some indeficiency, you need to be careful when you use Cai Hu, because Cai Hu will make the indeficiency worse, and the patient may be more irritated. So here, when we use Xiao Yao San, the Cai Hu, sometimes we use 1 gram or 2 gram, and or sometimes we even take of Cai Hu, we don't use them at all. We use Bohe. We add Bohe for 1 gram. It's also used to relieve the liver heat, the internal heat from liver stagnation. So when we modify them, we talk the Xiao Yao San, the main cause have 3 aspects. One is liver stagnation, blood stasis or blood deficiency, and spleen deficiency. So when we see the patients, we need to think which part is dominant. If the patient have the liver stagnation, and the stagnation causes internal heat, the patient we can see very obvious heat condition. Then we can modify Xiao Yao San. We add 栀子 and 丹皮, 牡丹皮. So this 牡丹皮 can clear the heat, and 栀子 also can clear the heat. When we use 栀子, sometimes we use 焦栀子. 焦栀子 is brown 栀子. It's 栀子we're going to bake. Very similar to the brown ginger. We're going to stir fry. We're going to stir fry until the color become brown. We use brown 栀子, it's because the property of 栀子is cold, and the patient got the spleen deficiency. Although it have internal heat, so it's conflict in this condition. We will use something to clear the heat, but you don't forget the spleen deficiency. We use brown 栀子to make it warmer. It's not harmful to spleen. The second is if the patient shows spleen deficiency. So if the dominant is spleen deficiency, the patient feels fatigue and the tongue was pale and fat. And in this condition, we will add some herbs to tonify spleen more. So we can modify Xiao Yao San. We add 党参. When we add 党参, it becomes 党参茯苓白术. It becomes 4 gentlemen, which is very good to tonify spleen. And even if the spleen deficiency is worse, we can add 黄芪 to tonify them. If the patient shows the liver dampness, it's because of the spleen deficiency. The patient may have dampness. So if the patient shows dampness and heat, in this condition we can use 丹栀Xiao Yao San. So we add 牡丹皮 and 栀子. Same as what we talked just now, when we use zhizi, we need to stir fry first to make it. And the blood deficiency, when we discuss blood deficiency, when you see patient got the liver stagnation, got the blood deficiency, we need to see, we need to think that if the patient still have blood stasis, how do we know the patient has blood stasis, especially in women? When the period comes, the patient may feel the distending feeling in the breast and also become very painful. And sometimes they have headache. Also, when you see from the tongue, you can see the tongue is, the color of the tongue is dark, and sometimes they got the dark spots that also can indicate blood stasis. So in this condition, we can use 单支逍遥散. So even for infertilities, due to liver stagnation, we can use Xiao Yao San. And if the patient shows the blood deficiency, which is if the patient will have dry eyes or the dryness in the body, especially the eyes. So in Chinese medicine, we thought why you can see something because your eyes got the nutrition from the blood. If you got the dry eyes or itching eyes or uncomfortable, irritate feeling in the eyes, it can indicate the blood deficiency. So when we use Xiao Yao San, we can add something to modify, to tonify the yin deficiency. So in this condition, if the patient have dry eyes or some irritate feeling in the eyes, we can add some like 生地、石斛, and even 枸杞, because liver insufficiency and kidney insufficiency always stay together and they're going to affect each other. So for 单支逍遥散, for women, when they have dysmenorrhea, which is or painful menstruation or infertility due to liver stagnation, we can use 单支逍遥散. Then you can add some herbs to improve to activate the circulation, and especially for painful menstruation, we're going to apply the herbal medicine 1 week, 5 to 7 days before the period comes. So the patient going to take for 7 days before the period. That's how to treat the painful menstruation, especially for some diseases. If the patient shows the liver stagnation, and also if it shows the spleen deficiency, if the dominant spleen deficiency and have some blood deficiency and liver stagnation, so in this condition, sometimes we will use 4 gentlemen formula or 4 gentlemen plus. We add 黄芪 or 香砂 6 gentlemen formula. So sometimes we need to think are we going to treat the liver or are we going to tonify the spleen first? These are some issues we need to think in our daily practice. Thank you for watching our video today. For more information, you can visit our website. See you next time.